The Supreme Court's decision also comes as President Obama enters the summer stretch of his re-election. Republican presidential candidate Mitt Romney, meanwhile, says if elected president, he plans to repeal Obama's health care law, while Obama says the law is in the best interest of the American people.
Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it.
Our mission is clear. If we want to get rid of Obamacare, we're going to have to replace President Obama. My mission is to make sure we do exactly that we return to the American people the privilege they've always had to live their lives in the way they feel most appropriate.
For the uninsured, the law leaves in place the individual mandate that all Americans are required to have or buy health care by 2014 or face a penalty. In 2014, that penalty will be $285 per family or 1% of income, whichever is greater. Then it goes up after that. For the insured, because the requirement remains for people to have or buy insurance, the revenue stream designed to help pay for the law remains in place. So, insured Americans may be avoiding a spike in premiums that could have resulted if the High Court had tossed out the individual mandate but left other requirements on insurers in place. And starting in 2014, the law makes it illegal for any health insurance plan to use pre-existing conditions to exclude, limit, or set unrealistic rates on coverage.
Meanwhile, Governor Robert Bentley released this statement about the ruling. It says, in part, I am deeply disappointed by today's Supreme Court decision. The health care law is an overreach by the federal government that creates more regulation, bureaucracy, and a dramatic increase in cost to taxpayers. The ACA, the governor says, is the worst piece of legislation to come out of Congress. This law must be repealed. Those words today from Governor Robert Bentley of Alabama.
And while the health care debate continues on a political stage, how people will be affected is still pretty much a large unknown at this point.
WVUA's Victoria Sheehan spoke with several health care providers here in West Alabama to see how the news has hit them and how they plan to move ahead with the expected changes.
It's a very positive thing for us, mostly for our patients, the opportunity for them to have affordable health insurance.
I think it's safe to say that this will set the stage for a pretty momentous change, perhaps not as big as 1965 when Medicare and Medicaid were created, but it's certainly going to be a major change in the face of health care.
Momentous, maybe, but complex is what the mandate is for healthcare providers looking at the future of their industry.
From our end, of course, we're a heavily regulated industry. This will bring in whole new books of regulations will be coming our way. So we've got to be looking for that, and then just the effects on the insurance marketplace and what those will do.
Experts say when the mandate is implemented, it could change the design of insurance products. But just because it's insurance, it doesn't always mean it's good. And there lies big uncertainty.
To our bottom line is, both as hospitals and as providers, we don't even know what these programs are yet. But if they're cheaper, but not as good, and somebody opts for those, there could be an effect on the healthcare industry where people are insured, but it's only fair to middle and insurance.
And that's why it's important to be informed. And thanks to community-based organizations like Maud Watley Health Services, people don't have to wade through the options alone.
In this situation, because we're talking about insurance for everyone and balancing the risk across populations, the ability to enroll large numbers of people, both who have health issues but also people who don't have health issues, is extremely important.
Reporting in Tuscaloosa, Victoria Sheehan, WVUA News.
And according to Tucker, current construction going on at Maud Watley Health Services is being made possible through a grant through the President's health care law.
Another big story we're following for you tonight, the extreme heat all across West Alabama.
That's right, we're in store for several days of triple-digit temperatures. Chief Meteorologist Richard Scott is monitoring that situation and has the very latest. Hi, Richard.
Hey, Philip and Lynn, yeah, very hot this evening. Right now, we're below 100 degrees officially in Tuscaloosa, 99, but 101 in Birmingham, 100 for Warrior, Jefferson, over in Jefferson County, northern part of the county, Jasper, 100 degrees, 99 down at Demopolis, and 100 in Utah. Temperatures actually go up from here, so the next several days will feature temperatures about 5 to 7 degrees warmer than it was out there today. Southeast, we're dry, no rain, no cloud cover to deal with. We will stay rain-free. Really all the way through the weekend. No chance of organized showers, storms to talk about. Here's a quick cast tonight. 93 by 7 o'clock. Still very hot. Also very muggy by 7 o'clock. Temperatures fall back around 75 as we approach the midnight hour. But how about the rest of the forecast and your weekend forecast? Weather is straight ahead.
All right, thank you, Richard. And during these extreme temperatures, it can only take a few minutes for some people to become ill.
Got to take it seriously. DCH Regional Medical Center's Director of Emergency Medicine, Dr. Derek Jones, told us the ER sees a spike in heat-related cases when these temperatures go up. Dr. Jones says the key to protecting yourself is always stay hydrated and pay attention to what your body needs. Jones says those hit hardest are the people in extreme age categories, the youngest and the oldest.
Well, we worry a lot about extremes of age, mainly because once they get in a situation where they're getting dehydrated and overheated, they don't have the ability to take themselves out of those situations. So very young children and very old adults, or anybody who's debilitated and really can't get around.
And when it comes to your plants, they need extra care too when the temperatures spike. Teresa Johnson, known as the Plant Lady, says if you're planting new flowers around this time, you should use water crystal granules to hold moisture onto the roots. And the key to keeping plants healthy during this extreme heat is water, water, and more water.
Plants in 100-degree weather with a heat index of 115 aren't going to like it. They're going to need more water than normal. So heavy watering in the morning is very crucial, very important. If you have to water in the evening, that's okay when it's this hot. You may have to do morning and evening.
And Johnson says your plants can never have too much water during this sort of intense heat.